Hi, Clinical Instructor Academy students. I'm here today to demonstrate how to correct a positive march test. And the reason this is so important for Pilates instructors is when there's a really strong malalignment of the pelvis and you go to do all of your core stabilization exercises, they're really not going to be able to effectively integrate the system and really benefit from the therapeutic program that you're giving. I firmly believe that Pilates instructors can learn some very basic assessment and treatment techniques to restore the mobility of the sacroiliac joint. So let's just say you learned that Christina has a positive right march test, meaning she's limited in her mobility of her right SI joint. I'm going to have her lie on her back, and I'm going to ask her to hold on to the posts or the dowel of the springboard, just so that she doesn't slide down the table with me. And then keeping her left knee bent, she's going to straighten out her right leg. And I'm just going to carefully grab hold of her ankle and ask her to just keep her leg as relaxed as possible. And then I'm just going to give a very gentle pull, almost like a pull and a tug. And ideally when I do this, they'll feel a little bit of a stretch in their hip, sometimes even into their low back, but nothing painful. We're going to use the muscles around her pelvis that attach to her ilium to kind of toggle the pelvis and restore the movement. And so we're going to use the hamstring and glute of her right hip, by placing the dowel behind the knee. And then we'll bring the other leg up, and she's going to actually hold the dowel, which at home could be like a broomstick or a mop or whatever they have. And she's just going to gently press the back of her right leg and the front of her left leg into the dowel for an isometric contraction that she holds for 5 seconds. I usually tell people about an 80% effort here. Sometimes people really want to work with it and they push really hard and the dowel's moving. This is just called muscle energy technique. The concept is just to get the muscles around the pelvis to help restore movement of the pelvis and the SI joint specifically. And so she'll do this about 5 seconds, 5 times. Once she's completed that, we'll take the dowel out from the legs, and then you will take your hand or a yoga block or even something like a magic circle, and you will ask the client to give a strong squeeze inward. Really squeeze. Sometimes when you have the client do this, you'll hear a little noise, or the client will even feel it around their pubic ramus, and that's nothing to be concerned about. Once they've done the little squeeze, they'll do about 3 to 5 non-articulating bridges. So we just lift the hips as one unit, feel the glutes start to engage, and then release and lower. And that concept with the bridges is you're kind of setting the pelvis that you've just realigned. You're now creating some stability, some continuity in pelvic alignment. And then after this, what we'd have her do once she's done her bridge work is we'll have her come back up into standing and we'll reassess the march test, just like we showed you in the previous module. And ideally, that movement now will be restored, where you'll see the ilium start to move posteriorly as she flexes her leg. Thanks so much for joining.